Depression is a mental illness that can heavily damage an individual both physically and psychologically, depending on the severity of the condition. Although depression can occur in an individual in a wide variety of ways, depression is a mental illness that is a highly treatable condition and can be overcome with the proper amount of medical attention. According to Psychology Today, appropriate and proper treatment for the mental illness depression begins with a common physical examination carried out by a professional medical physician. Psychology Today also stated that due to the fact that some medications as well as some medical conditions have the ability to cause an individual to have the same or very similar symptoms as depression, it is important that the medical physician examining the patient finds out as much as possible about the patient to make an accurate diagnosis. When a medical physician or doctor is interacting with the patient to find out as much as possible about the patient, it is highly important that the physician should question the patient about possible alcohol and drug use, as well as question the patient about possible, along with reoccurring, thoughts of death and or suicide. Once the patient is diagnosed accurately by their medical physician, treatment for the patient's condition can begin. A patient that is diagnosed with depression has various treatment options. Everyday Health stated that due to a wide variety and range of treatment options available to a patient diagnosed with depression, it is highly essential to stay informed about the methods of possible treatment. Everyday Health provided the fact that drugs and medications are common and very typical therapies to help people with depression. Drugs and medications are often supplemented and associated with the very common psychotherapy treatment. Psychotherapy, in addition to drugs and medications, is a common treatment that treats depression with counseling and a talking type of therapy instead of the use of medication. In the event that common treatments of depression such as drugs, medications, and psychotherapy prove to be insufficient, there are medical procedures and combination therapies that can treat the more severe cases of depression. According to Help for Depression, due to the fact that every patient dealing with depression is different, there is no consensus on either the cause or the best approach to treating depression. This is why it is essential that the patient diagnosed with depression receives the best possible and accurate as possible diagnosis of their case of depression. Now, finding an effective and working treatment in regards to drugs and medications and different types of therapies may take a while to discover. But there are alternative methods and lifestyle changes that can be made to help a person significantly improve in their day-to-day lives. According to Help for Depression, alternative methods include nutritional supplements along with meditation and lifestyle changes including dieting and exercising regularly. In conclusion, it is up to the patient as well as their medical physician to determine which treatment for their patient's case of depression is most effective. Please understand that the information that I have provided to you should be used for research purposes and to provide a general understanding of the possible ways to treat depression. If you are in need of counseling, need help in treating depression, or may know someone who is dealing with depression, seek help immediately. For more information on possible treatments of depression as well as understanding possible depression treatment options, please take an online visit to depressionhelper.com. My name is Rob Maldonado, and thank you for watching.